Good evening. Today I am going to discuss three major points regarding high blood sugar, that is diabetes. Three major points with three examples. Okay. Number one, you should hear very carefully, then only you will understand. You should hear very carefully. Okay. Number one, I will discuss about number one. I'll tell about this situation two times. I'll tell about this patient two times. Okay, just here. Okay, number one, first situation. Okay. A husband or a person, okay, a male person asked me, or he told me that his wife is suffering from high blood sugar, that is diabetes, for almost 13 years. How many years? A male asked me that his wife is suffering from diabetes, that is high blood sugar, for almost how many years? 13 years. Okay, almost 13 years. And she is taking or she is eating sugar tablets, that is diabetic tablets, and insulin regularly. What's the word I told? Regularly. She is eating diabetic tablets and insulin regularly. I repeat the word regularly. Along with that, she is also eating tablets for pressure, that is high blood pressure, cholesterol, and thyroid, along with the sugar tablets. How many years? 13 years. Is she eating her tablets and insulin regularly? Yes. She is eating her tablets and insulin regularly, and she is eating her own home food only. She is eating her food from the home prepared food. Home prepared food. Okay, she is not eating in hotels and all. She is eating her home food only. And she goes for morning some 10 to 15 minutes walking also. Did you understand the situation? Okay. You want me to repeat? No. Just, okay. So what they did? Okay, anyway they are frequently visiting doctors, frequently eating tablets. So everything is going on from almost 13 years. So one day they decided to do her HbA1c. Have you heard about HbA1c? Have you heard about HbA1c? They used to do once in every 3 months, average. Have you heard about that? So one day they did HbA1c recently they did HbA1c. It was 8.5. It was 8.5. They were clearly instructed to keep their HbA1c less than 6. Right? So, she was taking tablets and insulin regularly. The keyword is regularly. And her HbA1c was 8.5. So, they were in panic. They were afraid. In spite of eating tablets for 13 years and in taking insulin for almost 13 years and going for walking also and eating only food prepared in their home, her HbA1c was 8.5. So they were so much afraid whether she might get a heart attack or she might have any kidney problem or she might have any eyesight problem. So they were, or she might have any big wound in the leg. So they were, those are the normal complications of diabetes. So they were so much panic. Her HbA1c after taking tablets for almost 13 years was 8.5. So what they did, the next day, they went to another laboratory. They went to another lab. The next day, today they did, it is 8.5. Today HbA1c is 8.5. So the next day they went to another laboratory or another lab and they repeated the HbA1c again. Do you know what was the value? It was 12.5. So today HbA1c is 8.5. So the next day they went to another laboratory and they did. HbA1c was 12.5. They asked me why. They asked me why. Did you understand this history? Did you understand the history of this patient? How complicated question. You have to think. You have to think. There are so many people in the world. There are so many people in the world suffering from same situation. There are so many people in the world suffering from the same scenario, same history, same story, right? Have you heard about this? HbA1c, today it was 8.5, so they got panic. Next day they went to another lab or another laboratory. HbA1c was 12.5. So confusing and so confusing. So many people in the world are suffering from, are confused with such medical reports. So there is so much panic. And they asked me, doctor, why? 13 years she is taking tablet regularly. 13 years she is taking tablet regularly. She is going for walking also. She is eating mostly home food only. Then why this issue? So today has got it. So let us. This is the first case scenario for you to think. So this is the first case scenario, or this is the first case history for you to think. Keep thinking. Keep thinking. Keep thinking. Okay. Over. So now let us go to the second case. Second case history. Okay, second case history. Second case history. Okay, next one. Okay, now. A female asked to me about her husband's diabetic history. Means a wife asked about her husband's diabetic history. Okay. Her husband was suffering from diabetes for almost 7 years. Her husband was suffering from diabetes for almost how many years? 7 years. 7 years. He is taking tablets and insulin for diabetes regularly. Here also the situation is regularly. And he is eating most of the time the food prepared from their home. Most of the time he is eating the food prepared from their home kitchen. And he spends at least 3 or 4 days in a week for a slow walking. Okay. So, understand this. Your wife was asking to me about your husband. Diabetes 7 years. Taking tablets and insulin regularly. Most of the time eating food from their own home food. Weekly or maybe 3 or 4 days he used to go for walking. And frequently when they do their HbA1c, it was around 6 to 6.5. Sometimes it will be 6, sometimes it will be 6.1, Sometimes it will be 6.2, 6.4, 6.5, 6.8, something like that. So it was almost near normal. So HbA1c was almost near normal. Okay, 6.4, 6.5, 6.6, 6.8. Okay, so they were okay. Just hear closely. Okay, now I'm going to tell what the mother asked me. 7 years diabetic husband, taking tablets and insulin regularly, walking okay occasionally, taking only home food, no smoking habit, no alcohol habit. No smoking habit, no alcohol habit. HbA1c was also normal only. 6, 6.4 or 6.2, 6.4. No, it is almost in between 6 to 7. So 3 months back, some few days back they did, her HbA1c was 6.4. Few months back they did their HbA1c was 6.4. So they were happy. Suddenly one day after that he got a chest pain and he got a massive heart attack. He was admitted in the ICU, intensive care unit. Then they applied angiogram and they have put a stent. She asked me, my husband was suffering from diabetes for 7 years, taking tablets and insulin regularly, home food, no smoking, no alcoholism, occasional walking. HbA1c was almost normal. HbA1c was almost normal, 6.4. Why did my husband got heart attack in spite of his HbA1c was 6.4, which was done few days back? Did you understand the question? She asked me why my husband got heart attack even though or in spite of his HbA1c, which was done some 2 to 3 weeks back, was 6.4. Keep thinking. I'll tell you the answer in the last. Keep thinking. Don't forget the first case. Don't forget the first case. This is about the second case. Okay, did you understand the second case? You must think. Both are tricky questions by the patient. But answer is very easy. Both are tricky, confusing questions by the patient. But the answer is very, very easy. I'll explain you at the end of the video. Last part of the video. If you hear the entire story in the video, you will understand why. So first case over, second case over. Now I am going to discuss about the third case. Very thrilling case. Third story is a very thrilling story. Very thrilling story. Okay, now just hear. Okay, keep hearing this. Okay. So, husband and wife both came to my clinic. So, husband came to my clinic, wife. Both have come to my clinic as a couple. Husband and wife has come to my clinic as a couple. Okay. Now just hear what the husband is telling very clearly and see what the wife is telling. Okay, just concentrate. So I'll first, husband is asking me like this. I am suffering from diabetes for 8 years. So husband is asking me, okay, I am suffering from diabetes for 8 years. I don't take tablets and insulin regularly. I don't take tablets and insulin regularly. I am a smoker. I smoke. I smoke. I occasionally used to take even alcohol. I occasionally usually take alcohol. I don't go for walking. I don't go for walking. And most of the time, except for morning tiffin, I used to eat my food from the hotel. I'll repeat once more. Husband asked me, sir, I am suffering from diabetes for almost 8 years. I don't take my tablets and insulin regularly. Once in a while I used to take, if I have any other symptoms. If I have any symptoms, I'll take for 1 month. If I have any symptoms or if I feel tired, I'll take for 1 month. Again, I will leave for next 4 months. I smoke. I am a smoker. I am a smoker. I take alcohol. I have the habit of alcohol. I don't have the habit for walking. No walking business. I don't have time for going for walking. And most of the time I used to take my food from the hotel except for morning tiffin. And sometimes night dinner also I used to come and take in my home food. But most of my time I am taking food from the hotel. His HbA1c was 14. And his HbA1c was how much? 1,4. I am talking about the husband. His HbA1c was how much? 14. Okay, now this husband is asking about his wife. So husband told his history to me. Thrilling history. Okay, now this husband is explaining the diabetic history of his wife. See, now he is telling, my wife is suffering from diabetes for almost 7 years. My wife is suffering from diabetes for almost 7 years. She is taking tablets and insulin regularly. She is taking tablet and insulin regularly. She eats food prepared from their home. She eats food prepared from their home. She goes for walking maybe twice or 3 times in a week. And her HbA1c was 7.2. And her HbA1c was 7.2. So I told about the history of the husband. Husband told the history to me. Did you understand the husband's history? Don't forget that. And the husband is telling about his wife's history. So wife, diabetes for 7 years, taking tablets and insulin regularly, eating only home food, going occasionally for walking, and her HbA1c was only 7.2. Only 7.2. Husband's HbA1c was 14. Husband is a smoker, alcoholic, irregular tablets and insulin, highly irregular tablet for insulin. Okay, see the trick, see the brilliant question. Just keep watching me, what I am going to tell. Husband asked me, my wife is suffering from kidney problem. My wife is suffering from heart attack and stent problem. My wife is having a wound in the leg which is not at all healing at all. My wife is so weak. My wife's knee joint is so much painful. My wife is not able to do her routine activities. She is having severe shoulder pain. He asked me, my HbA1c is 14. I did not have any complaint. My wife's HbA1c is only 7.2. She is taking tablets and insulin regularly. Then why did she get heart problem, kidney problem, leg wound problem, knee joint problem, full tired problem? Keep thinking, okay? I have told you 3 medical history. I have told you 3 medical history for you to think. This is happening all around the world. The 3 situations which I told you is happening around the globe. Do you know why? Have you heard situations like this? I have told you 3. There are so many. I can tell so many histories like this. I have told you only some important thing. I told you 3 stories, right? Have you heard about this? Have you heard situations like this? Have you heard about situations like this? The answer is very, very easy. I will be explaining about the answer very clearly to you in just by telling 2 points. Just by giving you only 2 points. A disease can be cured without complications. I'll repeat. A disease can be cured without complications only if the reason for that disease is corrected. I am going to repeat it once more. Any disease can be cured only if the reason for that particular disease is corrected in a natural way. Shall I repeat once more? Any non-communicable disease must be corrected by a natural method. All non-communicable diseases should be corrected or kept under control only by natural method. So, hope you got the point very clear. Hope you got the point. Natural method, very clear. I am not discussing about tablets, I am not discussing about insulin, nothing. In this video, I am not going to explain you about any tablets or insulin. I am not going to explain you about any tablets or insulin. I have told you the natural method. Okay, let me ask you only one question to you and finish the discussion. Let me ask you only one question. What is the major reason There are so many reasons. Let us forget about that. Father diabetes, mother diabetes. Let us not no discussion about that. What is the most important reason for single most important reason for sugar disease? Sugar. That is diabetes. Can you tell me? What is the most important reason for type 2 diabetes? Can you tell me? What is the most important reason for type 2 diabetes? I think in this world, everybody knows the reason, including you. Shall I repeat the question? What is the single most important reason for type 2 diabetes in adults? I think you know the reason. Do you know the reason? Yes, you know. Everybody in this world knows this answer. Eating unbalanced home food. See how simple the answer is. But the disease is a complicated disease leading to stroke, blindness, heart attack, kidney failure, leg removal, finger removal, depression, constipation, knee joint pain. See, small disease with big complications. Everything can be handled only in an intensive care unit. Everything can be handled only in an intensive care unit, ICU. Stroke, blindness, heart attack, kidney failure and dialysis, leg removal, leg amputation. Small thing we have to do, right? I'll tell you. So, okay, let me come here. So, what is the single most reason for type 2 diabetes in adults? Eating unbalanced home food. See, we know the reason. You know the reason. You know the reason for type 2 diabetes now. Even if you are not hearing this video, you know the reason. Only thing, you are not prepared to correct your balanced home food. You know the reason. Type 2 diabetes in adults, most important reason is eating unbalanced home food. Because we know the reason, it is very, very easy to treat this type 2 diabetes. Because we know the reason, it is very, very easy to treat this type 2 diabetes, which is a killer. This killer disease, this diabetes is the cause of, is the reason for all ICU patients. This diabetes is the only reason, almost major reason for all the patients inside the ICU, intensive care unit, stroke, blindness, heart attack, kidney dialysis, leg amputation, finger amputation. So what is the single most reason for diabetes? Eating unbalanced food. Even if you eat your food prepared from your own home, I'll repeat, even if you eat your food prepared from your own home kitchen, and if it is not in a balanced form, you can have type 2 diabetes. Type 2 diabetes. Okay, shall I repeat? Even if you eat your food prepared in your home, and if it is not in a balanced form, you can get type 2 diabetes. You can get type 2 diabetes. So what is the single reason for type 2 diabetes in adult? Eating unbalanced home food. See, we know the reason. We know the reason. So, because we know the reason, type 2 diabetes is the easiest disease in the world to be treated. Because we know the reason for type 2 diabetes, it is the easiest disease in the world to be treated naturally. To be treated naturally. To be treated naturally. Because we know the important reason for type 2 diabetes. That is eating unbalanced home food. It is the easiest disease in the world to be treated naturally. Naturally. You must treat diabetes naturally. You must treat diabetes naturally. So what you should do? You must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. Shall I repeat? Protein, fat, vitamins, minerals and carbohydrates. This is called balanced home food. So, if you eat your home food in a balanced form, naturally, with correct amount of protein, fat, vitamins, minerals and carbohydrates, it is very, 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 very easy to treat type 2 diabetes. So what is the natural way to treat this type 2 diabetes? Eat your home food in a balanced form. Because this is the reason, this is the culprit. Got it? That is why I told you in the beginning. A disease, especially a non-communicable disease like diabetes, should be treated in a natural way. So type 2 diabetes is due to eating unbalanced home food. So what is the treatment? So if you eat your home food in a balanced form and keep your HbA1c, your fasting blood sugar, your postprandial blood sugar, everything normal, then you can escape from stroke, blindness, heart attack, kidney dialysis, leg amputation, etc. See how easy it is. See how easy. I'll repeat. If you keep this dangerous diabetes type 2 by following a natural method, that is eating your home food in a balanced form, and if you keep your HbA1c and all these things which I told you, fasting blood sugar, postprandial blood sugar, if you keep these things in normal by natural method, then you can escape from unnecessary complications like stroke, blindness, heart attack, kidney dialysis and leg amputation, which are all the major complications of type 2 diabetes. If you enter an ICU, intensive care unit, you can see all the patients which I told you, just because of a small silly disease called diabetes. You know the reason, but you don't take any effort to eat your home food in a balanced form. That is the problem. Including you, don't take much effort to eat your home food in a balanced form. People don't want the natural method to keep their blood sugar under control, to keep their HbA1c under control. Only if you keep your HbA1c and your blood sugar under control by following a natural method, that is balanced home food diet plan, you can escape from stroke, blindness, heart attack, kidney failure, that is kidney dialysis and leg amputation. Be very careful. In this video, I am not going to talk about any tablets and insulin. Right? So, first three, medical history. Did you get the answer? Did you get the answer? Did you get the answer? Keeping HbA1c by following home food is important. Keeping fasting blood sugar by eating balanced home food is important. Keeping your postprandial blood sugar by following a balanced home food is important. If you keep your HbA1c, fasting blood sugar and postprandial blood sugar by following the natural way, that is eating your home food in a balanced form, you can escape from stroke, eye blindness, heart attack, kidney dialysis and leg amputation. Got it? Got it? So I'll explain with a diagram to you. I'll explain with a diagram. See, so many people are running. Diabetes. Oh, running. Morning 1 kilometer, evening 2 kilometers running. See, diabetes is caused by eating unbalanced home food. So what you should correct first? Diabetes, type 2 diabetes is caused by eating unbalanced home food. So which you should correct first? You should correct your balanced food. So diabetes is caused by eating unbalanced home food. So you should give importance for food or you should give importance for running. I am not telling you not to go for running. You go for running for physical fitness. You must go for walking daily for physical fitness. When I talk about type 2 diabetes, tell me whether you should give more importance. More importance means almost 100% importance for food, or you should give more importance for running and walking. Which is important? Tell me. Food or running? Diabetes is caused by eating unbalanced home food. Diabetes, type 2 diabetes is caused by eating unbalanced home food. So what you should give more importance? For food or for running? You should give more importance for food. Right? Normally a person eats almost 1500 to 2000 calories. Okay. Usually people eat from 1500 to 2000 calories. Even if you go for fast 1 kilometer running, you can burn only 80 to 100 calories. Shall I repeat? Normally people eat from 1500 to 2000 calories, normal food. Even if you run for 1 kilometer so fast, you can burn only 80 to 100 calories. If you go for slow walking for 1 kilometer, you can burn only 40 to 50 calories. Think. You will eat for 1500 to 2000 calories. You will run for 1 kilometer and burn 100 calories. What is the use? That is what I am telling you. Balanced home food diet plan. You should keep your HbA1c, fasting blood sugar and postprandial blood sugar by eating a natural method. That is, you must eat your home food in a balanced form. Otherwise, only by running. You cannot. I am not telling you not to go for running. I am not against running. Well, you can go daily for half an hour walking morning, half an hour walking evening for physical fitness. You must go for walking daily, at least for half an hour, even if you are not a diabetic. Even if you are not a diabetic, you must go for at least half an hour slow walking to keep you fit. See, this gentleman is 58 years old. How many years? 58 years old. He is 128 kgs. He is 128 kgs. I reduced his weight to 86 kilogram. See, he is 58 years old, 128 kgs. I reduced his weight to 86 kilogram. Totally, I reduced 42 kgs for this gentleman. No exercise, no protein powder, no juice, no walking, no running, no swimming, no bariatric surgery, no treadmill, no protein powder, no juice, no walking, nothing. I gave him a balanced home food diet plan with correct amount of protein, fat, vitamin, minerals and carbohydrates, and I reduced his weight from 128 to 86 kg, 42 kgs. See, this gentleman is 58 years old. This gentleman is 58 years old, suffering from diabetes, pressure, cholesterol, thyroid, constipation, knee joint pain, and he is eating tablets for almost 16 years. Can I tell this gentleman to go for running 1 kilometer? Just think. Is it practically possible? This gentleman is 58 years old, 128 kgs. Eating tablets for sugar, pressure, cholesterol, insulin, thyroid, constipation, knee joint problem, all. He is eating this much of tablets every day. 58 years old. Can I tell this gentleman to go for running? Just think. Is it practically possible to go for, forget about running. Is it practically possible for this person to go out of his home for walking? Is it practically possible for this gentleman to go out of his house for walking? If I tell this gentleman to go for walking for diabetes, it is a sin. It is a sin. 58 years old, 128 kgs. If you tell this gentleman to go for walking, he will have it is a sin. Number 2, his heart rate will shoot up to the high. He will have massive tachycardia. He will have sudden heart attack and sometimes he will die. Number 3, he will have severe knee joint pain and knee joint injury. He cannot even sit for toilet. Just think, we should be practical. Not just telling, okay, morning 2 kilometers running. See, is it possible for this man? Just think. Just think. 58 years old. Is it practically possible? 58 years old, 128 kgs, eating tablets for sugar, pressure, cholesterol. Can I tell him to go for running for 1 kilometer? He will have 3 major complications. Number 1, difficulty in respiration. Number 2, his heart rate will shoot up, massive tachycardia. He might get sudden heart attack and spot death. Number 3, he will have knee joint injury or knee joint pain, and he cannot even sit for toilet. So if I tell this man to go for running, is it not a sin? Is it not a sin? The carry home message. You can cure this type 2 diabetes only by one method. That is, you must eat your home food in a balanced form. I will repeat. You can treat or you can cure this type 2 diabetes only by one method, one natural method. That is, you must eat your home food in a balanced form. That is the carrying of message number 1. Number 2 carrying of message. You must keep your HbA1c, fasting blood sugar and postprandial blood sugar normal only by adapting a natural method, that is eating your home food in a balanced form. I am not talking about any tablets and insulin in this video. I am not talking about any tablets or insulin in this video. I am telling you, diabetes, type 2 diabetes is caused by eating unbalanced home food. So only if you eat your home food in a balanced form, you can treat type 2 diabetes without complications. Without complications. Number 3, if you want to escape from stroke, blindness, heart attack, kidney dialysis and leg amputation, you must keep your HbA1c, fasting blood sugar and postprandial blood sugar only by following a natural method, that is eating balanced home food diet plan. If you don't take steps to eat your balanced home food diet plan, you will suffer from dangerous complications like stroke, blindness, heart attack, kidney dialysis and leg amputation. Be very careful. We are going to live in this world only once. Shall I repeat once more? We are going to live in this world only once. We are going to live in this world only once. If you eat 4 tablets daily for 1 year, you will eat 1460 tablets. If you eat 4 tablets daily, you will eat 1460 tablets for only 1 year. If you eat 4 tablets daily for 1 year, you will eat 1460 tablets in just 1 year. Be very careful. So you know the reason, but you don't have time and you don't take energy and you don't take any effort to take your home food in a balanced form. You know each and every person in this world knows that type 2 diabetes is due to eating unbalanced home food. But still they don't want to correct their food pattern. They want to take tablets and insulin. That is what happening. And so all the hospital intensive care unit is full. Yes, that is happening. If you eat your home food in a balanced form, you can enjoy in the wedding day of your grandchildren. If you eat your home food in a balanced form and stop your unnecessary tablets and insulin, you can enjoy your grandchildren's wedding day healthy. You can enjoy your grandchildren's wedding day healthy. Be very careful. Otherwise you will have to eat this much tablets. You will eat this much tablets. Morning tiffin this much tablet, afternoon this much tablet, night this much tablet. So many people now in this world are eating the tiffin as tablet. Sugar 1 tablet, pressure 1 tablet, cholesterol 1 tablet, thyroid 1 tablet, 1 vitamin tablet, 1 constipation tablet, 1 knee joint pain tablet. This much tablet morning tiffin. Afternoon again tablets for lunch. Night again tablets for dinner. I have seen patients eating almost daily 23 tablets. 23 tablets per day. Heart 1 tablet, kidney 1 tablet, brain 1 tablet, eye 1 tablet, cough syrup 2 cough syrup. Be very careful. You should take care of your body immunity. If you want your body immunity to withstand small illness, you must eat your home food in a balanced form and stay without tablets and insulin. If you want to keep your body immunity, if you want to withhold your body immunity, you must eat your home food in the balanced form. If you don't eat your home food in a balanced form, do you know what will happen? See, the blood vessel get inflamed. The inside of the blood vessel get inflamed. Atherosclerosis, inflamed, atherosclerosis, and the damage, so block. See, if there is block here, blood will not go outside. Block, no blood. Be very careful. That is why I am telling you. You must keep your HbA1c under normal by eating a balanced home food. You must keep your fasting blood sugar under normal by eating a balanced home food. You must keep your postprandial blood sugar normal by eating a balanced home food, not by eating this much of tablets and insulin. Not by eating this much tablets and insulin. Only if you eat your home food in a balanced form and keep your blood sugar and HbA1c under normal, you can escape this type of block. See, you can escape this type of block. See, this is called atherosclerosis. This is called atherosclerosis. See, block, no blood. No blood will go here. Got it? Hope I made this video so clear. Hope I made this video so clear. See, this is the heart. This is the heart. If the blood vessel in the heart get blocked, heart attack. If the blood vessel in the heart gets blocked, heart attack. If the blood vessel in the brain, get blocked, stroke. You will be bedridden. Stroke. If your blood vessel in the kidney, this is kidney. If your blood vessel in the kidney get blocked, atherosclerosis. If your blood vessel in the kidney gets blocked, kidney dialysis. You have to do kidney dialysis. If your blood vessels in the eye, get blocked, you will get diabetic retinopathy and total blindness. You will get diabetic retinopathy and total blindness. See, last, leg. If your blood vessel in the leg is blocked, if the blood vessel in the leg is blocked, no blood will flow here. See, I'll show on. See, leg of a diabetic patient. What happened? This is the leg. The blood vessel is blocked. See, the blood vessel is blocked. So, leg amputation, leg removal, finger removal, great toe removal, all the fingers removal. Be very careful. I think this video you understood what you should do for diabetes. I am not talking about any tablets or insulin. I am talking about the best natural way to keep your blood sugar under control, to keep your HbA1c under control. So, now coming back Now coming back to the 3 stories which I told you in the beginning. Now coming back to the 3 stories, not the story, it is a medical history. It is a medical history told by the 3 patients. Okay. So now coming back to the beginning of the video. Can you remember the 3 questions asked to me by some patients? Did you get the answer? Did you get the answer? Now you have to rewind this video. Now you have to rewind the video. Hear the 3 medical histories again. And hear the video again. Then only you will understand. Then only you can understand. Am I right? So you have to go back. You have to rewind this. Hear the 3 medical histories what I told in the beginning. Then hear the full video again. Then you will understand that a diabetic person should be careful so that his blood vessels should not get blocked inside. His blood vessels should not be damaged inside. His blood vessels from head to toe. Now you would have understood that you should be very careful so that your blood vessel from head to toe should not be damaged inside. Inside. Nobody can see this. Nobody can see this. Only if you get a stroke, then you will do MRI, CT, then you will find out. Only if you get a heart attack, then you will do an angiogram, then you will find out with complications. Only if you get a big wound in the leg, then you will do Doppler and see whether there is any block. No use. You cannot go inside and do big magic miracle, except for you can stand in the for the heart. You can go and keep some stent and come back. When you come back, you will have this much tablets. After stent, you come back home, you will be with this much tablets. If you eat 4 tablets daily, how many tablets you will eat in 1 year? Tell me. I told you 3 times in this video. If you eat 4 tablets for 1 year, how many tablets you will eat? If you eat 4 tablets daily, for 1 year, how many tablets you will eat? Tell me. 1460 tablets. This much tablets you have to eat for 1 year. Got it? So what is the key home message? A diabetic person should be very careful so that his blood vessels is in the the inside part of the blood vessel should not be get damaged. Gradually it will get damaged, and finally it will go for atherosclerosis and narrowing. It will get narrowed, blocked, and blood will not go down. If it happens in the brain, stroke. If it happens in the eye, blindness. If it happens in the heart, heart attack. If it happens in the kidney, kidney dialysis. If it happens in the leg, leg amputation or finger removal, something will happen. Or permanent bandage in the leg. Be very careful. That is why I am telling you again and again and again. You know the reason for type 2 diabetes. You know. Tell me whether you know or not. Tell me. You know the reason. But you don't have time. You don't have time for health. You know the reason. In spite of you knowing the reason for type 2 diabetes, you don't have time. You don't have time. For what? For health. People don't have time for health. People have time for disease. Yes. I have seen so many patients. People don't have time for Health. They have time for disease. They have time to get admitted in the ICU, stay there for 10-15 days, go home with this much of tablets, again eating tablets so regularly. See, health and disease both are different, okay? Don't forget about that. Health is different, disease is different. You must take importance for what? For health. We live in this world only once. Why live in this world with this much of tablets daily? Keep thinking. I'm talking this for a great awareness for you. Obesity. People are running, full gymming. Obesity. If you run, what will happen? Death has happened. So many deaths has happened, and you would have read in the newspapers. Have you not read? If an obesity person is running for daily 5 kilometers, playing badminton, and suddenly he collapses, who will take care of his family? Only if you eat your home food in a balanced form, you can reduce your overweight, you can stop your sugar tablets and insulin, your blood pressure will come down, your bad cholesterol will come down, your fatty liver will become normal, your gallbladder stones will become normal, your knee joint pain will become normal, your constipation will become normal, your ulcer problem will become normal, your indigestion problem will become normal, your snoring will become normal, your psoriasis will become normal, your PCOD will become normal, your PCOS will become normal, your hormone problems will become normal, your infertility problem will become normal, and you will have a healthy baby. Your erection problem will become normal, your sperm count will become normal, your depression will become normal, your stress will become normal, you will have a good level of confidence, you can take care of your family, you can take care of your spouse, you can take care of your children, you can attend your grandchildren's wedding day. To do that, it is very, 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 very easy. You must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. I, Dr. Shiban, specialized from world famous Madras Medical College, give balanced home food diet plan for all the diseases which I told you just before. I, Dr. Shiban, MBBS DCH, specialized from world famous Madras Medical College, give balanced home food diet plan for all the diseases which I told you just before. My cell number is 944 34 87004. 944 34 87004. Did you like this video? Was it very informative? Was it very informative? Tell me, was this video very informative? Tell me, man. Tell me. I am also so excited after talking to you for almost 1 hour. I am also really excited, I have given a very awareness message for the world, not only for you. If anybody hears this video, it will be a great awareness. It will be a great awareness message. Am I right? So what you should do? You should forward this video to your good friends or relatives who are suffering from sugar, pressure, cholesterol, PCOD, PCOS, no baby, fatty liver, thyroid, constipation, ulcer, pressure, kidney failure. Because almost all the non-communicable diseases are easily treated by balanced home food diet plan. Right? Shall I wind up? I think I have given a lots of information. So weight loss is the easiest treatment in the world. Treating diabetes is the easiest treatment in the world. Treating bad cholesterol is the easiest treatment in the world. If you eat your home food in a balanced form, if you eat your home food in the balanced form, you can escape from heart attack, stroke, eye blindness, kidney dialysis, eye problem, and leg amputation. See, heart attack, stroke, kidney dialysis, total eye blindness, and leg amputation. If you eat your home food in a balanced form, you can escape from all the complications and attend your grandchildren's wedding. See, this is life. This much is life. These are the patients in the intensive care unit of all hospitals. See, so if you eat your home food in a balanced form, you can escape from entering an ICU, intensive care unit. See, how nicely I have explained to you. So if you don't eat a balanced home food diet plan, this much of tablets, unnecessary complications. See, the medical word for this blockage is called atherosclerosis. Atherosclerosis. See? So, last question to you. I am going to finish. Last question to you. I am also so much exhausted. I have talked to you almost for 1 hour 10 minutes. The throat is also getting pain, right? So, last question. The last information. Any non-communicable disease. I am talking about non-communicable diseases. NON. Non-communicable diseases. Any non-communicable disease should be treated by eating your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates. You open the net and you search for non-communicable diseases. You will find what are the diseases. Non-communicable diseases. Almost all the non-communicable diseases, there is only major reason. There are so many reasons. I am talking about the most important reason. I am talking only about the most important reason. The most important reason for type 2 diabetes is unbalanced food. The most important reason for bad cholesterol is unbalanced food. The most important reason for PCOD, PCOS, hormone problems, irregular periods is eating unbalanced home food. The most common and only reason for overweight is eating unbalanced home food. The most common reason for constipation, eating unbalanced home food. The most common reason for ulcer problem and indigestion, eating unbalanced home food. The most common reason for male erection problem, low sperm count in males, is eating unbalanced home food. The most common reason for migraine headache, eating unbalanced home food. The most common reason for pimples in the face, eating unbalanced home food. The most common reason for heart attack is eating unbalanced home food. The most common reason for stroke, eating unbalanced home food. The most common cause of diabetic retinopathy is eating unbalanced home food. Right? So this is the carry home message. There are so many non-communicable diseases. You can open the internet and you can search in the net and you can find out. NON, non-communicable. COMMI, NUNICABLE, non-communicable diseases. So what is the carry home message? A disease can be cured only if the reason for that particular disease is corrected in a natural method. Natural method. So how you should treat type 2 diabetes? By eating a balanced home food. Otherwise, you will have to enjoy all the 3 stories which I told you in the beginning of the video. If you don't follow your balanced home food diet plan and keep your HbA1c and your blood sugar under normal, you will have all the stories which I told you in the beginning of the video. Hear this video once more. Hear this video 5 times. Hear this video 10 times and teach this information to your children. Don't forget to teach this information to your children. I repeat, don't forget to teach this information to your children. Let them transmit to your grandchildren. Let them convey this information to your grandchildren. They should know that diabetes can be cured only by eating unbalanced home food. Diabetes cannot be cured only by running for 10 km, 2 kilometers. They should know that. They should know that for diabetes, food is the main thing which we have to correct. Second thing is walking or slow running. Second thing, maybe the last thing. It will be. I told you now why it is the last thing. Even if you run for 1 kilometer, you will burn maximum of 80 to 100 calories and you will eat for 1500 and 2000 calories. So running is only a dot. You can go for slow walking every day to keep you physically fit and mentally fit. You must go for slow walking daily. Even if you are a healthy person, you must go for slow walking daily for half an hour at least to keep you mentally fit and physically fit. So stay tuned with Dr. Shiban. Thank you. Cheers. Thank you.